My name is Sarah Heath. I'm the PCC Manager at Summit, and I'm an incoming medical student at the University of Utah. I was born in Chicago, Illinois, and then ended up in Virginia in a suburb of DC, and that's where I grew up for most of my life. I worked as a personal trainer for 2 years, and that was actually a really defining moment because that helped me figure out what direction I wanted to go. I loved personal training. I loved the science and being able to apply it. While I loved it and I loved working with people, it wasn't my path and it pushed me towards medicine. I worked as a patient care coordinator for 3 years, and I loved it. It was really defining because as a patient care coordinator, you get to be with a patient before the provider sees them. You pull them out of the waiting room, you grab their vitals, and you chat with them about their medical history and chief complaint. And then you scribe during the visit, and after the visit, you help them wrap up and send any orders or referrals. And so seeing that process of healthcare was awesome, and being able to chat with patients every day, I feel like it really helped me to see what patient-centered care is and that I could play that role, that I could do that. I had the opportunity to be the patient care coordinator manager. At the time, that was managing a team of about 50 college students, which has been crazy and exciting, and I've learned so much. My advice to an incoming PCC would be to take all the feedback you can get. The providers we work with at Summit are so invested in good patient care and also our success as patient care coordinators. Take all the feedback and grow as much as you can. My biggest advice is to lower the barrier of entry for habits that you really want in your life. If you're trying to, start exercising, in your head you have this dream of exercising 6 days a week for an hour and it's gonna look like this. But if you're not gonna do that, lower the barrier of entry so that you're doing something and you'll be able to build off of that. And I've loved working at Summit. I think that as a patient care coordinator, I really felt like I was part of the care team. That gave me the opportunity to learn and to connect with patients, develop the skills that I'll need to be a better physician, but also that culture of teamwork and everybody, front office, back office, everybody working together to make sure that patients get good care. That is something I'll carry forward into all of my future positions.